Hi everyone, this is Dr. Umesh Belagi, CEO of Nice HMS. And today's topic is crucial one, that is managing healthcare costs in India. Focus is on out-of-pocket expenditure. Let us find out what is this out-of-pocket expenditure in healthcare. Out-of-pocket expenditure is nothing but patients themselves pay for the healthcare cost, which is not reimbursed by any agencies or government schemes. Let us break it down and answer some crucial questions. Why in India the out of pocket expenditure is so high? Is it because of hospital charges, or is it due to government expenditure on health, or is it due to private insurance? Out of pocket expenditure in healthcare is a daunting challenge in India, with a staggering 61.2% of the healthcare expenses being shouldered by patients themselves. This creates a significant burden, especially for the 12% of the population living below the poverty line. Now, our government's vision for universal health coverage is a commendable shift from health for all to health for all with a financial protection. To address the alarming fact that 7% of the citizens are being pushed below the poverty line each year due to medical expenses. It is important to note that laying the blame on the private health sector for high out of pocket expenditure is totally not justified. In this graph, you can easily see in the year 2013 and 14, the government spent around 30% of the total health expenditure. At that point of time, the out of pocket expenditure was around 60%. Progressively over the year, government has increased its expenditure on health. So, in the year 2019, it reached around 40%. At that point of time, even the out of pocket expenditure also reduced. So, this graph shows that private health sector is entirely not responsible for out of pocket expenditure in India. Also, let us dispel the myth surrounding medical inflation, often attributed to hospitals. In reality, the focus should be on the raising premiums of private healthcare insurance. Many private hospitals do participate in government schemes for patients like PMJ. These aim to elevate the burden for poor patients. It has to be noted that the government schemes payments are very low. Hospitals often find it difficult to treat the patients under these schemes. Now, the hospitals do get some extra revenue by treating the private healthcare insurance patients. IRDA is currently focusing on regulating the prices even in the private insurance sector. IRDA need to understand that when the hospitals are underpaid in the government schemes, they need to compensate by liberalizing the private insurance payments through cross subsidy. This model is present in the USA, where the Medicare government patients underpayments are compensated by more liberal payments from the patients with private insurance. The medical inflation in India is a manifestation of increasing premiums of private insurance. This is mainly due to poor penetration of insurance, and in India, health insurance is bought more by older people, that is 45 years and above, many of whom have undisclosed chronic illnesses. This aspect has to be noted by the IRDA before attempting to control the prices in hospitals. Furthermore, the IRDA should focus on empaneling more and more hospitals through single empaneling process. This will increase the competition and have a beneficial effect on patient as well. This is akin to abolishing license Raj of the previous millennium. Actually, the burden of out of pocket expenditure comes from outpatient department services. This is not covered by either government schemes or private insurance. This aspect needs to be addressed by the IRDA. For OPD patients, cashless services require fast turnaround time in terms of claim processing by the insurance companies and hospitals. This is only possible through digitalization of health records and a single window for all third party administrators, including government schemes, through health claim exchange. While the IRDA is making progress, it is at a much slower pace. The IRDA, along with ABDM, is working towards the digitalization of health and claiming processing. We are proud to mention that we from Nice HMS are also ABDM triple milestone certified health information management system. If you are interested in learning more about our HIMS, we would be more than happy to provide you demo. For further details, please check the description below and feel free to write to this email. As we at Nice HMS continue our journey, let us work towards a healthier and more affordable future. I, Dr. Umesh Belgi, CEO of Nice HMS, thanks for tuning in. Don't forget to like this video and subscribe for more insightful discussions.